I'm Dr. Imelda Wong, and along with Dr. Naomi Swanson, it is our pleasure to serve as moderators for today's webinar. On behalf of the NIOSH Working Hours and Fatigue Work Group, we are pleased to have you join us today with our featured speaker, Dr. Daniel Mollicone. Dr. Daniel Mollicone is a chief scientist and the CEO of Pulsar Informatics. He holds degrees in engineering physics and biomedical engineering and has played an active role in the development of the field of fatigue risk management. He has acted as a principal investigator on research funded by the U.S. Department of Transportation, U.S. Federal Aviation Administration, U.S. Department of Defense, U.S. National Aeronautics and Space Administration, Civil Aviation Safety Authority of Australia, and the National Sciences and Engineering Research Council of Canada, and Transport Canada related to assessment of fitness for duty and fatigue risk management. A disclaimer that the findings and conclusions in this presentation have not been formally disseminated by the National Institute for Occupational Safety and Health and should not be construed to represent any agency determination or policy. For more information about this presentation, please visit the NIOSH Work Schedules webpage. Thank you for your participation today, and now I'll turn it over to our featured presenter, Dr. Mollicone.
Thank you, Dr. Wong and Dr. Swanson, for inviting me to present today. Today we're going to be talking about fatigue risk management. And so we start by going into the basics, the background, the science of fatigue, which provides the foundation for putting in place practical procedures to monitor for and mitigate fatigue in the workplace. In our paradigm, we see fatigue risk management as a two-sided coin. And the two sides of this coin, on the one side we have the organizational responsibility. So the organization has to provide work schedules that provide for adequate rest opportunity. That is the primary responsibility of the organization. That provides individuals with time off and sufficient time off to get adequate rest on a daily basis. The other side of the coin is the professional responsibility of each worker, that is, to use the time off given to get adequate sleep and to show up for your duty shift in a fit state and be able to complete your workday, start, middle, and finished, start, middle, and ending in a fit state. And so there are many fatigue stressors that would lead to getting into a position where fitness for duty is in question. What I'll do is I'll break down three factors that directly impact the biology of fatigue. The first is sleep debt. So what is sleep debt? Sleep debt is when you get inadequate sleep on a daily basis. So if you need 8 hours for sleep, we understand that the average sleep need across the population is around 8 hours. Some people need slightly more and some need less, but the average is 8. And so assuming you need 8, if you got 6, that would be a deficit of 2. And if you repeated that for 2 days, that's now a debt of 4. And if you did it for 3 days, the debt grows to 6. And as the sleep debt increases, we see increasing fatigue deficits. The only way to pay off a sleep debt is by getting the sleep you need and some recovery sleep for 1 or more days. And so it's like a debt, any other debt, like a debt for to the bank, for instance. The way you pay off a debt to the bank is you send the money to the bank. The way you pay off a sleep debt is by getting the sleep you need. The second factor is time of day. So time of day is important because of our circadian rhythms. And particularly night work and early starts are sensitive to fatigue, and we experience elevated fatigue risk for night work. And the reason is that humans are not nocturnal. That is, humans are a daytime species. So owls are nocturnal, mice are nocturnal, bats are nocturnal, humans are a daytime species, which means that our circadian rhythms upregulate us during the day and downregulate us at night. When we work at night, this means we're working against our biology. That is, if you're feeling drowsy at work or you're having alertness, difficulty maintaining alertness at work, it's not that there's necessarily something wrong with you. It's your body doing what it's supposed to be doing. That is, the body is programmed to be drowsy and sleepy during the nighttime hours. And the fact that we're working is something that we can do, but we have to follow additional procedures to make sure that we do it safely and reliably, because we are working outside of our normal functional biological envelope. And then thirdly, the third factor is long days. So we're all good for around 16 hours. That is, when we collect data, what we find is all humans look more or less the same from the perspective of the stability of vigilant attention and alertness. We all look around the same up until about 16 hours, and then you start to spread the population out. And the most sensitive among us start to manifest deficits in the 17th hour, where more resilient individuals are still good to go even in the 17th hour. And as we go to the 18th, 19th, 20th, 21st hour, eventually everybody drops off. And the longer we stay awake, the more individuals will reach the limit of their ability to cope, and then they begin to manifest deficits. And so there are significant differences here among individuals, but eventually everybody reaches their limit, and it's just a matter of when. So what are the effects of fatigue? On the screen at the present time are listed a number of effects, but as I go through them, instead of just reading off the screen, I'm going to pitch it another way. Let's pretend for a moment that I developed a new drug, and I was trying to market this drug and the benefits of the drug. And let's assume for a minute that this new drug helped to increase your ability to sustain attention. It decreased your impulsivity. It increased your ability to perceive risk and make good decisions. It increased your ability to make, to change strategies and think strategically. It enhanced your memory. It increased your response times, increased your concentration and your mood and your attitude. The first question is, would you buy this drug? And the second question is, how much would you pay for it? And the answer, I think, is yes, and the second answer is a lot, because these are all good things, especially if I were to tell you, and this drug has no bad side effects and will make you healthier in the long run. Well, the good news is this drug exists, and it's called sleep, getting the sleep you need on a daily basis. And when you don't get it, everything that I just mentioned, all of those properties, all of those features of our performance get worse. That is, when we get inadequate sleep, these things are all in a deficit state, and they impact our ability to be alert on the job and to do our job safely and reliably. So the question is, given that sleep is the magic thing that allows us to maintain our performance, why do we not prioritize it more, both in the way we schedule and implement our work schedules, but also the way we manage our time off duty? So let's dig into the three factors that I mentioned earlier and try to understand the scientific basis of why these factors are important. Sleep debt. So what's shown on the screen right now is data from a very famous study that was conducted by Drs. Dinges and Van Dongen at the University of Pennsylvania. And this is a very famous study, and it's famous for several reasons. One is the primary intent of the study was to look at sleep debt. Is sleep debt a real thing, and if so, how does it play out? And based on different ways that you can accumulate a sleep debt. So the way that the experiment was structured, individuals volunteered and came and lived in the hospital laboratory, and they were monitored with electrodes on their heads to measure their sleep-wake activity. Their heart was monitored, blood was drawn, and while they were awake, they did performance tests, including a very important performance test called the psychomotor vigilance test, the PVT. And the intent of the study was to understand quantitatively how humans respond to restricted sleep. And there were 4 different conditions. One group got 8 hours for sleep every day for the 2 weeks. A different group got 6 hours every day for sleep across the 2 weeks. A third group got 4 hours every day for sleep. And finally, one group got no sleep at all for 3 whole days. And they stayed on these schedules, and we measured their performance on these tests, and in particular the PVT. And on this chart, we see the data from the study, and on the horizontal, we see the days in the study, and on the vertical, we see numbers, 2, 4, 6, 8, 10, 12, 14, 16. These are lapses on the psychomotor vigilance test, lapses on the PVT. And what a lapse is, it's a period when your brain stops processing information. That is, your brain is gone for half a second or longer. And your eyes can be open, you could be walking, talking, driving a car at your job, and your brain's gone for half a second and then it's back, half a second or longer and then it's back. And these are lapses of attention, and we measure them with the PVT. And the reason why they're important is because we have found that these lapses of attention on the PVT are correlated with errors of omission in the workplace. That is, an error of omission is, I didn't see the brake lights in front of me. I skipped a step on my procedure. I made a stupid mistake in the task I was doing. Fatigue-related errors are oftentimes things that are simple, well within your training and competency, and they're characterized as dumb mistakes. But what they really are errors of omission, and usually related to lapses of attention that are measured on the PVT. So this is what we're measuring in the study, and you see that things are getting worse. Things are getting worse for all the groups in the study, but they're getting worse faster for those groups that are getting less sleep. In my opinion, the most interesting group in the study is the 6-hour group, and the reason why I think that's the most interesting group is because this is real life. That is, on a daily basis, people who are working shift work may only be able to get 6 hours of sleep, despite the fact that they need 8 and should get 8. Oftentimes, between all of the things that we need to do in a day, sleep sometimes it provides the elasticity in our schedule, and we tend to get less sleep than we need on work days. And so going 3 or 4 or 5 days with 6 hours of sleep is not, there's a prevalence there in the workplace. And so one of the very interesting things is that because we had this group that has no sleep at all, 3 whole days no sleep, we got to compare what it looks like to get some sleep, just not enough sleep, to getting no sleep at all. And the second reason why I think this study is so famous is because we got to do that comparison, and what we found was that after a week of getting 6 hours of sleep, you're as bad as someone who's been awake a whole day, a whole night, into the second day. That is, you're comparable to somebody who has been deprived of all sleep in a 24-hour period. And that's very interesting because when in this study, the participants were asked how they feel, how rate your alertness, what is your perceived level of fatigue, and what's your perceived level of alertness. The group in the total sleep deprivation group, the 0-hour group, they were fairly accurate in characterizing the level of their deficits. But the group that was getting 6 hours, they systematically underestimated the extent of their impairment. That is, when you have a sleep debt, you're underestimating your impairment and overestimating your abilities. And that's particularly bad because we are, in a workplace, one of the best ways to detect when a worker is fatigued is if they can detect it in themselves, but we've just learned with this data that when you have a sleep debt, you're underestimating the degree of your impairment. So this leads to the need for objective quantitative tools. If we can't rely on our own perceptions, what can we rely on? And this brings up the need for tools to be used to help us with quantitative objective framework. Okay, let's talk about the second factor, time of day. So we're not nocturnal, we're daytime species. This means we're upregulated during the day and we're downregulated at night. This means that work hours that happen during the night are at elevated fatigue risk. This means that early starts, where we have to get up at 5 in the morning or 4:30 in the morning or earlier, there's a fatigue risk component there. And what we have to do is we have to rely on tools to monitor our fatigue risk and procedures to mitigate our fatigue risk, because we can't just leave this to chance. That is, if we're working night shifts or early starts or late days, finishing late in the evening, we have to realize that because we're working outside of our biological functional envelopes, we really do have to follow procedures to precisely measure and mitigate. And in the same way, if you've ever gone scuba diving, this is humans doing something outside of our normal biological functional envelope. That is, we humans cannot go and swim under the ocean for an extended period of time because we need to breathe air. And in the same way, you would never consider scuba diving and not filling your tank with air. In the same way, you would never consider working at night without being fully rested in a fit state, because we're already going outside of our functional envelope, and to do so without the things that we need, the things that our biology needs, which are essential, we're putting ourselves at risk. Okay, let's talk about long days, extending the time we're awake. So this study was a study done by Dr. Dawson in Australia, and the intent of the study was to understand fatigue deficits relative to another modality where we see impairment, and that's alcohol, and to understand the relationship between the two types of impairment. And so the way that the study worked, people came into the lab and they were deprived of sleep for a whole day, a whole night, and into the next day, and they were studied with tests including the PVT, and their deficits were recorded. And then they were allowed to go home, rest, recover, and a week or so later they were brought back in and they were systematically fed alcohol, and their blood alcohol concentration was measured. And they did the same performance test including the PVT. And then the researchers afterward lined up the deficits and asked the question, at what level on relative to fatigue do we start looking like people who are drunk? And in particular, we're looking at the alertness, comparable alertness deficits. So that's to say that the alertness deficits are comparable, but being drunk is not identical to being fatigued. That is, in both cases, there's impairment and deficits, but alcohol also has many other different types of impairment that we don't see with fatigue, and in terms of the silliness or response inhibition, deficits in response inhibition, and things like that. So after 17 hours of being awake, in the 18th hour, we're already at 0.05, and in the 22nd hour, we're comparable to individuals who are 0.08 blood alcohol concentration, which is legally drunk in every state in the United States. So this brings up an amazing finding and a question, that is, how many of our workers, especially workers who work at night, are at a fatigue state that's comparable to being drunk at work in terms of alertness deficit. And when it's put that way, it really drives home how serious the fatigue risk can be. Okay, so if all of this theory matters, if this science really, really matters, then we should see outcomes in the workplace that are predictable based on the fatigue score. And what we see here is a metric from a safety-sensitive environment. It happens to be a transportation operation, and these are safety-critical events. And we're looking at them as a function of the fatigue of the worker. So the score on the bottom, these are not hours on duty or hours awake. This is a fatigue score that takes into account all of the biology and all the science that we know in the form of a biomathematical model, and provides a simple risk score. So this risk score, the meaning of it is 0 to 8, we typically interpret it as nominal. 8 to 12 is transitional, where we see the most sensitive among us start to manifest deficits. And above 12 is elevated fatigue, where nearly everyone has a measurable deficit by the time we have a fatigue score of 12, and some people are in a state of incapacitation already by 12. And as we go higher to 16, most individuals are reaching a state of incapacitation by the time we get to 16. And this performance curve is very important because it shows something that we need to understand that's very important relative to workplace safety. What it shows us is low fatigue, no problem. Medium fatigue, not that much of a problem. That is, humans are tough. We can cope with some fatigue, and even though we may feel a little bit tired, we're still holding our performance. That is, we're able to do our job safely and reliably. But what happens when you push a human beyond their ability to cope? Beyond their coping mechanism, what happens is we become incapacitated. That is, our error rates skyrocket exponentially. And this is the domain where we do not want our workers to be during their work shifts. And so we use tools like a biomathematical model-based approach or alertness tests to verify, to quantify and verify that our alert workers are not in this state. And if we detect that our workers are in this state, we take steps to intervene and to mitigate the fatigue risk. Because if we're operating out here in the 14 and 16 fatigue score zone, what's happening is we're creating safety hazard, risk of injury, risk of fatality, we're damaging equipment, we're having quality escapes, and it's simply not good business to be operating out in these extreme high fatigue domains. Okay, so let's talk about individual differences. So I have here listed 3 factors where we find differences among individuals, but there are more than these 3, but we'll talk about these 3 right now. So the first is sleep need. We said that the average in the population is 8 hours, but we know that some people need more and some people need less. Now, what's very interesting is we have data. We know that the individuals who need in the range of 6 to 7 hours is somewhere around 5 to 10% of the population. So it's 1 in 20 in the range of individuals need around 6 to 7 hours of sleep. When we provide a survey to a workplace and we ask individuals what they perceive to be their sleep need, we see about 35% of individuals will declare that they need between 6 and 7 hours. So we know from scientific studies that it's much lower than 35%, whether it's 5 or 10%. It's certainly not 35. And when we ask individuals what their perception is, we get the report is much higher, which means that approximately twice as many people are reporting that they need 6 to 7 hours of sleep when in fact most of those individuals need more sleep. So we have to be a bit true to ourselves and observe carefully and honestly, despite the fact that we would prefer to only need 6 or 7 hours of sleep. It just may be that our genetics, the way that our bodies are made, we need more sleep. We need 8 or 8:30 or 9 or whatever it is, and it's not laziness, it's just a biological fact. And you would never breathe less than your body needed to breathe. That is to say, if an individual needed to take so many breaths per hour, you would never breathe less than that. We would be hypoxic and we wouldn't feel very good. And you would never drink less water. I guess we do on occasion, not hydrate well enough. But we know the benefit of drinking the water that we need to stay hydrated, and we would never try to justify drinking less than that. So why are we doing this with sleep? If we need 8, let's target 8 and see if we can get the sleep we need and be alert. The second factor, morningness, eveningness. What does this mean? It means, do you prefer to stay up late and sleep late, or do you prefer to go to bed early and wake up early? This is a preference that's a trait of the individual. It does drift across the lifespan. That is, during the puberty years and young adults tend to be evening types, and older adults tend to be morning types. And there are individuals who are extreme evening types and extreme morning types. And this is something to be aware of because it impacts how we respond to different shift schedules. So a morning person with a 5 a.m. start, that's no big deal. A 5 a.m. start for an evening person is like murder. And so same schedule, 2 different biological preferences and 2 different fatigue risk profiles based on that biology. So we should really know and factor this information into how we approach fatigue risk management. Caffeine use. So caffeine next to oil and not counting water is the most traded commodity on the planet. Think about this. Not counting water, not counting oil, caffeine, coffee beans are the most traded commodity on the planet. We're never more than about 100 feet from coffee. it's a drug. It upregulates us. We treat it as a food, but it is a drug. It upregulates us. It's well tolerated by most people, and it's something that can be very useful as a fatigue risk management tool, especially if you use it as a drug. That is, if you abstain from drinking caffeinated beverages and treating it like a food and use it when you really wanted the alertness boost, it becomes a very profound and powerful tool that's available to you. What we find with caffeine use is that most people who use a lot of caffeine are overdosing on it. And what we have learned is somewhere around 300 milligrams a day is the biological limit where you saturate the adenosine receptors, and anything above around 300 milligrams a day provides no further alerting benefit, but is associated with more side effects like jitters and nervousness and anxiety and sleep disruption. So what we found is that a lot of people who are using coffee are 500 milligrams or 700 milligrams or 1,000 milligrams a day, when in fact there's no further alerting benefit above 300. So you're probably wondering, well, what's 300 milligrams? 300 milligrams would be 3 large Starbucks coffees in a day. So if you're having more than 3 large, strong coffees, you're overdosing in terms of getting alerting benefits. So our recommendation is drink something else, drink water, drink decaf, and save that caffeine boost for when you really need it. In terms of individual differences, caffeine affects us, it's very dramatic, the differences, in terms of a couple of things. One is, at a specific dose, how much of an alertness benefit do we get, and how long does that benefit last? And the half-life is one property of a drug where, in terms of the pharmacokinetics, asking what is the clearance rate of the caffeine in the body. And there are significant individual differences on the half-life, and that is how long does it take the body to clear half of the drug out of the system, by our kidneys and liver filtering it out of our blood. And that, even the bioavailability has huge individual differences. So there's a lot of sources of variance with respect to caffeine, and you want to know, where you are on that spectrum and how caffeine will work for you relative to fatigue risk management. Okay, let's look at another difference among individuals. This is your vulnerability. So let's think about this. When we are fatigued, some of us are more vulnerable than others to experiencing alertness deficits. And there's dramatic differences among individuals. Some individuals, when they're fatigued, are immediately incapacitated and are not reliable. Others are incapacitated during the day, but then they have, or during the night, but then they have circadian rescue. That is, during the day they get better. And then other individuals are very resilient, and in the face of fatigue are able to hold their performance up until extreme levels of sleep deprivation. And these are 3 different profiles. They're genetically instantiated trait differences. What does that mean? That means that you don't get to choose who you are. This is a trait of your body. So think of this in terms of sunburn. So sunburn is related to the amount of melanin in our skin, which is related to skin color, and darker skinned persons are less susceptible to sunburn compared to fair-skinned persons. So we have a differential vulnerability to getting a sunburn, and we have to know who we are. That is, we have to know what our differential vulnerability is. And if we have a job that presents a sunburn hazard, for example, we have to know what countermeasures, what mitigating steps I need to do based on my vulnerability in order for me to do my job and not let the hazards associated with my job victimize me. So what does this mean? Think of a lifeguarding station. A lifeguarding station out at the beach has a sun risk exposure, a sunburn risk exposure. And you have a population of lifeguards, and they all have genetically instantiated trait differences relative to their susceptibility to sunburn. So the individuals who have fair skin who are susceptible to sunburn, they need to take extra steps to ensure that they do not get sunburned. So what are those extra steps? Well, I'm going to put on sunscreen. I'm going to wear a hat, a long sleeve shirt, an umbrella. And if you do all of those things, you mitigate the risk of sunburn. And they're a good idea for everyone, but the folks who have darker skin are less susceptible to sunburn. They don't need to do as many of the mitigations because they don't have the same susceptibility. So the same goes for fatigue risk management. If you're sensitive to these stressors, then you have to pay particular attention to mitigating them because you're going to be the one that experiences the symptoms and the deficits most severely. So, relative to sleep need, be true to yourself. If you need 8 hours, get 8. Whatever it is you need to do during your time off, do those things to show up fit for duty. That's what this comes down to. When we we've been in business for 20 years and we've supported hundreds of organizations in mitigating fatigue risk. And when we started out, we really were interested in tracking sleep. We wanted to know what time you went to bed. And what we quickly realized is that tracking, when the employer is tracking sleep, this is a potential invasion of privacy. That is it my boss's job and right to know what time I went to bed last night? That's an ethical question I don't have the answer to. I know a lot of people would prefer to keep that information private. And so if it's not my boss's job to know what time I went to bed, what is my boss's job relative to being able to verify that I'm in a fit state and being able to do my job safely during my duty shift? And what it comes down to is our perspective is that your boss has the right to be able to verify that you're in a fit state and to verify that you can be alert and do your job during your duty hours. So it really is up to the individual to do all of the things that they need to do to show up in a fit state. And if that means going to bed early, then guess what? Go to bed early. If you're able to stay up a little bit later and still show up to work and be fit for duty, well, it's your choice. But the main point is we have to know what we need to do to show up in a fit state, and the employer, the organization, should be verifying that employees are in a fit state, that they're doing everything that they need to do in order to be in a fit state. So how do we do this? Well, we need a quantitative objective framework. So these are very important words, and I just want to break down the meaning as we're using them here. So quantitative, what does quantitative mean? Quantitative means numbers. And objective, what does objective mean? Objective means that the observer is irrelevant. That is, if length using a yardstick is an objective measure, and it doesn't matter if I'm measuring the length of the room, for instance, with a yardstick, or somebody else is measuring the length of the room with a yardstick. A yard is a yard is a yard, and it doesn't matter who's actually doing the measurement. A subjective measure, on the other hand, there's perception of the observer is taken into account. Think of figure skating in the Olympics. You have a Russian judge, you have an American judge. We watch a figure skating routine. The Russian judge scores it a 9, and the American judge scores it a 7. And then there's a big controversy. And the reason there's a degree of subjectivity. They both observe the same event, but they both have a different perception about it. So that's subjective. We're talking about an objective quantitative framework. Okay, so in that objective quantitative framework, one of the tools that we use is a biomathematical fatigue model. And what a biomathematical fatigue model does is it takes everything we know about the science of fatigue and everything that we can learn about the work-rest pattern, and we calculate a fatigue risk score for every hour on duty. And the way we do that is we start with the time card information, that is the work schedule information, and then we know when there is the opportunity for sleep, because that is the off-duty time, and then we know what the biological propensity of sleep based on our understanding of circadian rhythms and sleep homeostasis, and we estimate when the individual will go to sleep, how long they will sleep for, and when they will wake up. And people are incredulous about this step, because how could you possibly know when I'm going to go to sleep tonight when I haven't even decided when I'm going to go to sleep tonight? Maybe I'm going to choose to stay up late. Well, what we know is if we just track the biology and the work schedule data, we can predict with accuracy somewhere between 85 and 95% accuracy when sleep will happen and how much sleep will happen. And based on that, we know when you're at work, we have an estimate of when you're sleeping. We're going to score every hour on duty with a fatigue risk score. And it's really small on the screen, but you see on the screen it says 0, 5, 6, 7, 8, 9, 10, 11, 12. This is the same fatigue risk score that we've seen. It's not work hours, it's not hours awake, it's just a fatigue risk score. And what's shown on the screen are work shifts in a workplace across a month. So there's 106 work shifts on the screen, and that would be approximately 5 employees across a month at a small warehouse, for instance. And every single work shift is scored with the max fatigue. So what's the worst fatigue that we're going to experience based on the schedule inputs across this shift, and that score is put onto this chart. So if one worker on their first shift of the month gets scored at a fatigue score of 7 as their max fatigue, that adds a little Lego block in this plot at 7. And the first observation that you make is most of the action is between 0 and 10. And on our scale, 0 to 8 is nominal, 8 to 12 is transitional, 12 plus is bad. And what you see is all the actions, most of the action is 0 to 8, which means most shifts are nominal. That is, we do not have elevated fatigue risk on most of the work shifts that we're doing. And then you see there's half a dozen work shifts that happen in the 8 to 12 transition band. And then we see 4 shifts out of 106 shifts worked for this warehouse. In the last month, we see 4 shifts that happened at elevated fatigue. These are the 4 shifts we need to mitigate. That is, the first step in a quantitative objective framework is make a standard. And the standard in this case could be everything above 12 we're going to look into and investigate and mitigate if we verify that fatigue is a problem. So now we've changed the paradigm from having to mitigate fatigue on every single work shift to just having to mitigate fatigue on 4 work shifts across a month. So now it went from being a task that's overwhelming and possibly impractical to implement and too costly to implement to something that we can do surgically with a efficient investment of time and money. We can mitigate fatigue because we're only going to mitigate the bad stuff. We're not going to worry about mitigating stuff that's not looking too bad in the first place. So let's dig in on one of these bad schedules. What does it look like? So when we dig in with the tool, with the fatigue meter tool, the biomathematical model tool, what we find is that, let me first orient you to what we're looking at. So blue is estimated sleep, gray is the punch-in, punch-out data from the time card system or the scheduling system, and then the gray squiggly line is fatigue, up is bad. And you see this is a week of time and some duty shifts across that week, and in particular the second to last duty shift has elevated fatigue, as well as there's a bit of elevated fatigue on the last shift. But we also see this yellow dot. Well, this is something, an injury occurred, so we're looking at this retrospectively. We can use these tools to look forward, to help plan. We can use them in real time to monitor, and we can use them to look back and analyze incidents. In this case, we're looking at an incident that has happened, and we're trying to understand why. And so we run it through the fatigue meter, and we get this report, and we're looking at which day of the week did this accident happen. And it just so happens to have happened on the worst day of the week in terms of fatigue risk. And within the shift, which hour on shift did it happen? Well, again, it just happened to happen on the worst hour, the 10th hour of the work shift, which is the peak fatigue according to this tool. And so based on this data, the data suggests that fatigue is highly likely a contributing factor in this incident. And that's important to realize because then we can start tracking all those incidents that happen where we think fatigue was a factor and all those instances that happen where we don't think fatigue was a factor. And we can start to understand what our quantitative fatigue risk is. And what we see in the data is astonishing. That is, when fatigue is a risk factor, we see accidents happening at anywhere from 2, that is twice as often, to 5 times as often. And the worst we've ever seen is 27 times higher risk of injury or incident at work if the shift is rated as high fatigue versus not high fatigue. So this is a big deal. This is something that we can predict, measure, and mitigate. And so now it is our responsibility to do those things and to make our operations safe and reliable. So let's talk a little bit more about the meaning of the score. So the meaning of the score, we have here a table, and the way to interpret this table, these are really broad brush strokes. So we assembled this table by looking at scientific studies and looking at multiple different scientific studies in order to come up with some general guidelines of equivalent levels of impairment based on different modalities of becoming impaired. We have here extending wakefulness, sleep debt, and alcohol on this chart. And then trying to understand what is the operational risk relative to these levels. What is needed is a systematic study that looks at all of these factors in a controlled study to provide a more quantitative, precise version of this very table. But here we have this, and it provides a good general guideline. And what we see is at a fatigue score of between 12 and 16, it's comparable to being 0.08 blood alcohol concentration, and we see about a 3 times increase in risk of injury or accident. So that's the most important thing here. When we start to detect conditions in the workplace that are above 12, we want to take that information very seriously and look very closely and with a mind to mitigate it, to avoid the fatigue risk and to reduce the fatigue risk. So that's the organizational responsibility, looking at the schedule to make sure the schedule is not provoking fatigue. But again, we talked about what happens during the time off. Well, there's a lot of things that we can get up to during our time off that may potentially impact our fitness for duty. Up here, we call these the 4 Ds. And these are all things that can contribute to performance deficits and put fitness for duty into question. We have medication, we have alcohol, we have fatigue, and we have medical conditions. And without passing any judgment on the why, that is, why are you in a state that where your fitness for duty is in question, without passing any judgment, the first and foremost thing is we just want to find out which employees are fit for duty and which aren't, in order to provide support to those individuals who are not, in order to help them become, to be in a fit state. So this is about identification that there's a deficit and providing support to address that deficit. What we don't want to do is make this punitive. We're not trying to catch anyone. We don't want people to lose money based on this approach. We want this to be a just culture where we're working together to be as safe as we can be, and by screening and identifying individuals who need more support, we're able to give them that support and end up with a fit workforce, a reliable workforce, and a safe workforce. And if we do all these things, we're going to see that we have fewer errors, fewer accidents, we get our work done more quickly, the quality is better, we don't damage equipment, and we're more profitable. So an investment in fatigue risk management and fitness for duty assessment, if it's done right, you end up, the money you spend and the resources and time that you spend, you end up making money. That is, there's a return on investment here. You invest something, but you get something back. And the way you get it back is you have fewer injuries, fewer workers' compensation claims, fewer missed days of work, less equipment damage, et cetera, et cetera, et cetera. Less rework. Rework is when you do a job, but then you have to redo it because you didn't do it right the first time. And that's a huge, huge cost. And when we track it relative to fatigue, it's off the charts high, and some organizations represents a huge opportunity to improve the operational efficiency. So what do we do to quantify alertness? Well, why don't we just use the PVT? This is the tool that all the researchers are using. This is the quantitative, globally accepted gold standard quantification of alertness, so let's use that. And that's exactly what we do. We use the PVT, and we use a briefer version, a 3-minute version. The most common gold standard version of the PVT is a 10-minute version used in a lot of laboratory science. But for operational settings, a 3-minute duration PVT is much more practical and acceptable. And so there is a sensitivity loss compared to the 10-minute, but it's still a useful tool to identify when individuals are approaching that point of incapacitation. And so what makes the PVT so special? One is there's no aptitude differences. That is, it doesn't matter how smart you are. It doesn't matter how much education you have. It doesn't even matter what your title is. That is, it doesn't care or know about any of those things, and none of those things will help you on the PVT. It also has no learning effect. So after you familiarize yourself with the test and you figure out how to do the test, which may take 1 or 2 tests, after you figure it out, each subsequent administration, you don't get better and better and better at it. And so those 2 properties make it superior to virtually all other testing approaches, because those factors tend to confound other testing approaches. And so that's what makes the PVT so useful. And so we use it. And the way it works is you look at the screen, numbers start counting. When you see the numbers start counting, you touch the screen, and it shows you your response time in milliseconds. Normal adult reaction times are around 1/4 of a second. When you're in a fit state, when you're alert, you can do this all day long. And the biggest complaint we get about the PVT is it's boring and it's kind of dumb. But the truth is, when you're in an impaired state, you see lapses of attention, and the data is incredibly valuable for providing feedback to the individual and the organization to help assess the risk of incident and accident in the job. And so a 6-year-old could do this test, and it's easy to do, but when you're fatigued, it's very sensitive to those effects of fatigue, and it becomes very hard to will yourself to be able to do this test when you're in a fatigue state. So interpreting the score, again, 0 to 8, we think that's nominal. That is, we think that it's an acceptable level of errors before we become concerned about the reliability of the operator. 8 to 12, that's transitional. We should start worrying. And above 12, this is a strong sign that there's a fitness for duty problem. Now, these thresholds are not gospel. These thresholds are not carved in stone. They're not the law. They're not regulatory. They're based on our observations, and different workplaces will set different thresholds. So one of the organizations that we support, which is a safety leader, a leader in fatigue risk management and proactive fatigue risk management, is ExxonMobil. And we work in partnership with them and along with National Safety Council. And ExxonMobil has set more conservative limits than this based on their motivation to be as safe as they can be. So it really is up to the operator to set those thresholds, and it has to be right for their environment, and it should be guided by data collected from their, each organization's own environment. So let's talk about other tools. So the PVT is an objective quantitative standard, and it's very useful. But what is also useful is asking the employee, how do you feel? Are you fatigued? And this is a validated scale used to ask individuals how fatigued they feel, and it's called the Samparelli Fatigue Scale. Another scale that we use is called the Karolinska Sleepiness Scale, and it's another way of asking an employee how sleepy they feel, how alert and sleepy they feel. And these are important because the PVT will capture, it will quantify objectively the level of vigilant attention, but there are other aspects of our performance that it may not, it's not the end-all be-all. It doesn't capture every aspect of our performance, and sometimes just asking a person is a useful way to detect impairment. The way we implement fitness for duty evaluations is we have the PVT, but then we also ask using the subjective scales. And then finally, we just ask very simply, we provide 2 buttons on the iPad, and it says, one button says, I am fit for duty, and the other button says, I am not fit for duty, and the employee has to push which button applies to them. And sometimes they'll pass the PVT, and sometimes they'll even pass the subjective scales, but they'll then select, I am not fit for duty. And guess what? Maybe they have a migraine, and a migraine may not impact their PVT score, and they may not feel sleepy, but guess what? They can't see, they have blurry vision, and they have so much pain that they're distracted, so they're not fit for duty. So that's why we do it. We ask the question 3 different ways, one with the PVT, one with the subjective scales, and one with the I am fit for duty, I am not fit for duty binary selection, because we want to capture all instances where there's a sign or a symptom associated with elevated fatigue risk. So let's talk about resources. So one of the organizations that we support is National Safety Council. And National Safety Council is, a national organization with a mandate to help workplaces be safe. And we collaborate with the National Safety Council to provide our tools. We're an engineering company. We've a 20-year history of working for the Navy and the Army and NASA and the FAA, et cetera, and all of the expertise and engineering and tools that we have developed over this time, we try to package up as resources available to NSC members. And so one of the things that we have developed is a fatigue risk management toolbox, and that's available through National Safety Council. If you follow the link that's on the screen, that's a good starting point for a lot of organizations. Let's talk about, I'll dig in a little bit deeper here. So the first starting place is to have a clear set of policies where you stand as an organization relative to fatigue risk management. They should be non-punitive, and they should cover everything that they need to cover in terms of providing education and training. You need to have hours of service policies. If you're in a federally regulated industry, obviously you have to adhere to the federal regulation, but we recommend oftentimes being more conservative than the federal regulation. And sometimes I describe it this way. So the EPA has a limit for lead in water. But in your house, with your children and your family, you may not be striving for the EPA minimum standard set by the government. You may be striving for 0 lead in your water. And that's not unreasonable. And so you may opt to, if you have a good municipal source of water and there's no lead, that's good. But if there is some contamination, you may want to invest in a Brita filter or some other filter to take that extra step, because guess what? The minimum EPA standard's just not good enough for your family. And in that way, you as the organization can set the right limits for your type of operation for your employees that is based on data that you have. And so oftentimes you end up with more conservative limits than the minimum federal standard for hours of service limits. And then you want to communicate. It should be a shared responsibility, and you want to collect data. And so the National Safety Council, one of the tools in the toolbox is a policy template that you can download, and you can start to put in practice things that you're going to do as an organization to take a step forward relative to fatigue risk management. So let's look at 2 case studies. The first is, this was a pilot deployment of the PVT to assist fitness for work assessments at ExxonMobil. And this case study is published in the Journal of Occupational Environmental Medicine. And this was something we did in collaboration with ExxonMobil, and they have been a leader in fatigue risk management and taking steps to make their environment as safe as they can be. And the intent here was they have for safety-sensitive personnel, they have mandatory medical exams where periodically employees have to undergo a fitness for duty check in the company clinic with company clinicians. And we added the PVT to that process. And what we found was that 3 out of the 97 participants in this pilot program had elevated fatigue on the PVT, and elevated above what we would normally expect to see as part of normal night shift. And these 3 individuals, work limitations were made in a non-punitive fashion. That is, they didn't dock them pay, but they did make a work limitation. They were advised to go to their personal physicians to try and understand what was the cause of these deficits. And all 3 individuals came back with medical conditions that were undetected, undiagnosed. And once they addressed their medical conditions, they were in a fit state and they returned to work. And so this was a huge success because basically this helped, an objective quantitative framework helped ExxonMobil in this case, help to identify employees who needed some additional support in order to be alert and fit from the beginning, middle, and end of their work shift. and is an example. It's an exemplary case study in that this is something that is accessible to not only companies that are large, but medium and small companies, right down to an individual independent owner operator driving a truck can use all of these same approaches, and they scale down to the individual or up to the the mega corporation. Let's look at another case study. This was done with one of our partners in the trucking industry, J.B. Hunt, and again, J.B. Hunt, we have the honor of working with some of the safest companies in the business, and J.B. Hunt is one of them. They're an amazing company that they take safety very seriously, and they invest heavily into safety initiatives as well as fatigue risk management. And this was a pilot study done at one of the depots where we looked at providing feedback to drivers relative to their fatigue level corresponding to safety critical events that they experienced. And then we provided education and training about what to do, how to mitigate fatigue when driving a truck. And to our astonishment, the results that we got exceeded our expectations in that we saw a 60% reduction in safety critical events after a year of implementing this program. And this case study is a few years old now, and this is something that we published with J.B. Hunt, and it's available on our website. But we're now in year 4, and what's amazing about this program, and I'm happy to report that we've sustained the gains, that is we've maintained low levels of safety critical events, and we've even made year over year continuous improvement, so it got better and better and better each year. So we're thrilled about this result, and it really proves what can be accomplished when using quantitative objective framework and engineering approach and tools to monitor for and mitigate fatigue risk.
Great. Thank you, Dr. Mollicone, for a very interesting and informative presentation. If you would like a copy of the unedited transcript, please email Total Worker Health at the email link below. On behalf of Dr. Naomi Swanson and the NIOSH Working Hours Sleep and Fatigue Work Group, I'd like to thank Dr. Mollicone for his presentation today and to the viewing audience for their participation. If you are interested in other presentations in this series, please visit the NIOSH Work Schedules website, and we hope that you can join us for the next installment in the NIOSH Directors webinar series in Working Hours, Sleep and Fatigue. Thank you, everyone.